colleagues, dear friends, distinguished attendees, good afternoon. My name is Victor Madrigal Borlos. I am a human rights lawyer born in Costa Rica, and I've been given the honor of moderating this panel of impact today, in which we are seeking to begin a reflection on the work of our dear colleague, Tlaleng Mofokeng, Special Rapporteur on the right to health. This panel and a series of activities that accompany it are entitled Times of Harvest. They're entitled Times of Harvest because we understand that the work of each mandate holder in the special procedures follows not only a mandate guided by each resolution in the Human Rights Council, but very importantly, by the strategic thinking of the mandate holder, informed by consultations with states parties, civil society, and other stakeholders, and by the vicissitude of the times in which that mandate holder carries out her work. We are therefore hoping to carry out reflections on the impact of the work of Special Rapporteur Mofokeng, as well as the way that this work inserts itself in the overall logic guided by the resolution of the Human Rights Council in relation to the right to health. We have a distinguished and illustrated panel with us today. We're very thankful to the panelists. I will introduce them as they speak, and we are honored to open with remarks from the distinguished representative of the mission of South Africa. Tulufelo Tuele is South Africa's Deputy Permanent Representative and Chargé d'Affaires to the United Nations Office in Geneva. A distinguished diplomat and human rights expert, she has been central to landmark negotiations, including the Business and Human Rights Treaty and the Declaration on the Rights of Peasants. Madam, you have the floor.
Excellencies, distinguished colleagues, partners, and friends, it is my honor to open this important conversation as we reflect on 6 years of principled, courageous, and deeply impactful stewardship of the mandate on the right to health by Dr. Tlaleng Mofokeng. Okay. I will continue. I hope that is okay and not start from the beginning. On behalf of South Africa, I wish to express our profound appreciation for the clarity, conviction, and humanity with which she has advanced this mandate during a period marked by global uncertainty, widening inequalities, and unprecedented public health challenges. Over the course of her tenure, Dr. Mofokeng has strengthened the normative foundations of the right to health in ways that will endure well beyond this mandate. Her work has sharpened our collective understanding of sexual and reproductive health and rights, bodily autonomy, health equity, and the obligations of states to ensure that no person is left behind. She has consistently grounded her analysis in lived realities, ensuring that the right to health is not an abstract aspiration, but a concrete entitlement. Importantly, the mandate has illuminated the structural and systematic barriers that continue to undermine access to health care for people of diverse sexual orientation, gender identities, gender expressions, and sex characteristics. Across regions, LGBTIQ+ and intersex persons continue to face discrimination, stigma, violence, and the denial of essential services. These are not marginal challenges. They are central to the global struggle for equality and dignity. Dr. Mofokeng's work has therefore helped to articulate these concerns within a human rights framework that is principled, evidence-based, and grounded in international law. Her reports have also highlighted the urgent need to end harmful practices affecting intersex persons, including non-consensual medical interventions. For many communities, these issues remain invisible. The mandate has brought them into the light, insisting that health services must be safe, respectful, and affirming for all persons without exception. This is a contribution of lasting significance. At the same time, we must acknowledge the political resistance that continues to shape global health negotiations. The right to health remains contested in many multilateral spaces, including in areas related to gender, sexuality, and bodily autonomy. Dr. Mofokeng has navigated these tensions with integrity and strategic clarity, reminding us that human rights principles must guide our engagement even when consensus is difficult. Her leadership has strengthened the credibility of the mandate and reaffirmed the centrality of the rights-based approaches to health. Moderator, the mandate's achievements have also been amplified through close collaboration with the World Health Organization. The alignment between normative guidance from the Special Rapporteur and the technical expertise of WHO has been essential in advancing comprehensive, integrated, and people-centered health systems, whether on sexual and reproductive health, mental health, universal coverage, or the rights of marginalized communities. This partnership has demonstrated the value of coherence between human rights mechanisms and global health institutions. As we look ahead, the work is far from complete. The next mandate holder will inherit a strong foundation, but also a world in which inequalities are deepening, public health emergencies are multiplying, and the rights of women, LGBTQ plus persons and intersex persons are increasingly under pressure. Continued collaboration between states, civil society, UN agencies, and communities will be essential to safeguard the gains achieved and to advance the right to health for all. Today's panel is therefore both a moment of reflection and a call to action. We gather not only to honor the legacy of Dr. Mofokeng's mandate, but to reaffirm our shared commitment to a world in which every person, regardless of who they are or whom they love, can enjoy the highest attainable standards of physical and mental health. I thank you.
Thank you very much, Madam. We are indeed grateful of the sponsorship of South Africa, Switzerland, and Brazil for this event, and I thank you in that context for your state's sponsorship as well as your thoughtful remarks. And in that context, it is now my honor to give the floor to a man who I know to be deeply concerned for human rights. I experienced his support when I was exercising my own mandate for the special procedures, and it is therefore my honor to invite His Excellency Tovar da Silva Nunes, Ambassador and Permanent Representative of Brazil, to speak on matters concerning state leadership and political stewardship. Excellency, you have the floor.
Thank you so much, Mr. Moderator, Caro Victor, distinguished panelists. Salute you, ladies and gentlemen, all participants. It is obviously an honor for us to be here sitting with such a distinguished selection of panelists, but also because I think it's important to reflect on the impact of Dr. Tlaleng Mofokeng's stewardship of the mandate. I think that's something that we would like to spend time more than the 4 minutes that was allocated to us, but because we think that it's important for us to reflect on a mandate that for Brazil, as you know, historically it means a lot, and health in general, because we think that the right to health is not only a legal commitment, it is much more than that. It's also a test of political choices, of institutional design, and public accountability. So, and we speak from the experience of a country that has been able to create what is now the largest public health service. We call it SUS or SUS, that is the Unified Health System of Brazil. That system was built on the principles, following our constitution, on the principles of universality, comprehensiveness, and equity. These principles are not self-executing. They require institutions, they require financing, they require also technical capacity and sustainable political leadership. And for Brazil, state stewardship means ensuring that the right to health is organized as a public responsibility. It means placing primary care at the center of the system, strengthening territorial services, and relying on community health workers and multidisciplinary teams to reach populations that are often remain at the margins of public health. It also means building procedures that connect science, transparency, and equity. Health technology assessment, pharmaceutical assistance, and public consultation mechanisms are not merely technical tools. They're actually instruments through which public authorities can decide how to allocate resources, incorporate innovation, and protect equal access. Such instruments must be defended against pressures that fragment the system or deepen inequalities. Public leadership also matters when governments reduce financial barriers to care. Policies that expand access to essential medicines, strengthen vaccination, improve digital health, and invest in specialized services show that the right to health depends on choices that affect people's daily lives. Norms become meaningful when they are converted into services that are available, accessible, acceptable, and of course, of good quality. At the same time, Brazil's experience shows that universal systems require permanent political attention. Geographic inequalities, workforce shortages, infrastructure gaps, systemic racism, discrimination, barriers faced by persons with disabilities, and digital exclusion continue to limit access for many groups. These are not only administrative challenges, they are human rights challenges, and they require cross-sectoral governance, adequate budgets, and policies guided by the social determinants of health. Democratic participation is therefore central to this effort. Health councils, ombudspersons, public consultations, and transparency mechanisms help citizens shape priorities and hold institutions accountable. Participation must not be treated as a ceremonial exercise. It is a part of the architecture that allows public systems to remain responsive and obviously legitimate. As we look ahead, the task before us is to strengthen the normative foundations of the right to health through accountable and equity-oriented state leadership, including in multilateral spaces such as the Human Rights Council and the World Health Organization. Governments must combine legal commitments with institutions capable of delivering care, allocating resources fairly, and protecting those most exposed to exclusion. And in closing, Brazil believes that the right to health becomes real when political leaders commit to turning norms into services, and when public institutions are empowered to deliver equitably. This is the commitment we must preserve and renew. Thank you.
Thank you very much, Ambassador. And I thank you for drawing our attention to the fact that there is a very specific dimension to the human rights-based approach. Non-discrimination, participation, empowerment, and accountability all have a very practical dimension and very specific connections with the exercise of constructing democracy. Thank you very much for that. Now, Excellencies, colleagues, distinguished guests, the special procedure system is the engine of the Human Rights Council's normative work. We have with us Marcela Fabretto, one of our illustrated colleagues of the Office of the High Commissioner for Human Rights. Marcela brings over 25 years of human rights experience, and since January 2026, she leads OHCHR's Development, Economic, Social, and Cultural Rights branch. Marcela, in addition, has extensive experience in Kenya, the DRC, and Sierra Leone, and has been central to the development of the OHCHR's Human Rights Economy Initiative. Ms. Fabretto, you have the floor.
Thank you. Excellencies, distinguished panelists, dear distinguished delegates, dear participants, it's really important and a real pleasure for us to have this moment to recall the extraordinary leadership exercised by Dr. Mofokeng as Special Rapporteur on the right to health. And it's good to have this moment to pause and recognize what has been achieved and how the mandate has been really optimized thanks to your leadership. you have been a principled and courageous leader. And so that in itself, we're extremely grateful for this, for your stance and for how you committed to really go the extra mile to make something exceptional about this mandate. I want to flag a few highlights. First is how you adopted a holistic vision of this mandate and how important it is to recognize the connection between the right to health and other economic, social, and cultural rights and civil and political rights. And we think you have done this very well, realizing the connection with housing, the right to food, social security, but also the way you went the extra mile to push for intersectional analysis of non-discrimination and recognizing how racial and gender equalities, for instance, intersect in undermining access to the right to health. So recognizing the structural drivers of exclusion. And this has really been a constant feature of your mandate, so it's been really, really important. The second is how you make the most of the toolbox that is available to special rapporteurs. You have issued foundational thematic reports. And I always say that I love reading the special procedure report because they really sort of push the policy boundaries in a sense that, you know, they respond to the topical and emerging issues. And you have done this really, really well. Let me recall the violence and the impact on the right to health report, racism and the right to health report, but also how you frame the health and care workers discussion as defenders of rights. So really, thank you very much. And then the country visits, talking about that toolbox and how they always ended with very clear and actionable recommendations. And again, these are extremely important because not only the fresh analysis that is left behind by the special rapporteur, but also a set of very actionable measures that the office together with governments can implement. At the global level, you've been there and you use your mandate to advocate for the right to health, including during COVID-19. You were a vocal, your voice was well heard and extremely important in pushing some instrumental discussion. And then the way you constantly focused on the rights holders, especially the issue of participation, and with focus on disadvantaged groups, making sure that they had sufficient space to bring their lived experience and not only to participate and bring their perspective, but really to shape policies and more importantly, you know, also not only shape policies by government, but also shape our work, the UN human rights system work. So really, thank you so much. The normative contribution, you have reaffirmed that sexual and reproductive health rights are integral to the right to health. And this is particularly important in the current global context. And this is just an example. I think it's, we can really, those who have followed this work, for sure, they can really think of how rich and important that dimension of work has been. And your successes are even more remarkable if one takes into account the complex environment that you've been operating in. A moment in time where critical issues such as sexual and reproductive health, gender equality, and bodily autonomy remain contested. So looking ahead, and I'm finishing here, our priority is clear. We must protect the normative gains achieved, and we must ensure their implementation. This means continuing our work of translating standards into laws, policies, budgets, and that's for sure a very important dimension under the human rights economy that we're committed to pursue with your work, and changes that make a difference in people's lives. So the past 6 years have brought significant progress. Thank you so much for moving the needle and planting many seeds that we are ready to sort of build on to ensure a lasting contribution to the right to health. Thank you.
Thank you very much, Ms. Fabretto. I am asked to remind the room that we are having interpretation to French and Spanish. For those of you who may benefit from it, we have our wonderful interpreters ensuring that we have this content available in those languages. Now, many of you know that mandate holders of special procedures develop relations not only with states and civil society, but indeed very special relationships with academia, who often facilitate the research work and are very important parts of the ecosystem in which mandate holders carry out their work. We're lucky to have Matthew Cavanaugh with us today. Mr. Cavanaugh is a political scientist and director of Georgetown University Center for Global Health Policy and Politics, where he also directs the UN Georgetown Collaborating Center on Inequality Policy, AIDS, and Pandemics. His work examines how governance institutions produce inequality, drawing on experience at the UN and in non-governmental organizations' policy leadership. Mr. Cavanaugh is joining us to address standard-setting contributions of the mandate. You have the floor.
Thank you very much. I have 5 minutes to describe what is an epic amount of work that has been accomplished by this special rapporteur. And I'm slightly embarrassed because the ambassador from Brazil has done a better job than I think I will. So let me give it a shot. What does a clinician from the Global South do with a 20-year-old mandate? So Paul Hunt gave us the triple AQ standard, which I won't go into, but that defined the right to health. He handed the baton to Anand Grover in the mandate, who set out several ideas, but the idea that the war against drugs and the war for affordable drugs were part of a right to health. And Denias Puras gave us the idea that the right to health moves beyond the biomedical. Dr. Mofokeng picked up the baton and brought us two very important innovations. One, how do you move this in practice? And two, how do you address the people who have been overlooked by the mandate thus far? And so I want to point out three threads that run throughout Dr. Mofokeng's tenure here, which will inform how we understand the right to health, both from a jurisprudential understanding, but also from a practice understanding. So first, coloniality as a diagnostic rather than as a metaphor. The idea of colonialism is often talked about, but the idea that colonialism ended, but coloniality, the surviving structures of power and knowledge, did not, so that today's inequalities are outputs of a still running system, the idea that that should inform the right to health is an innovation. Second, that intersectionality is a bridge to substantive equity. These are her words. But that formal equity treats substantive equity tackles structure and indirect discrimination. But intersectionality is how you see how we get to formal equity, what formal equity misses. And then finally, she broadened the determinants of health beyond what had been done, the social determinants of health, the structural determinants of health. But Dr. Mofokeng brings us the legal determinants of health and the commercial determinants of health within the right to health. So let me run through those quickly. First, one example. In her report on the racism as a determinant of health, Dr. Mofokeng brought in this understanding that racism, not race, is the key social determinant of health. But that racism does not stand alone at ethnicity and race, but is encompassing of the ways in which race and ethnicity intersect with misogyny, with homophobia, with other pieces of identity, and that when you bring these things together, then you are able to finally see. And so she was able to point out the multiple ways in which seeing helps realize the right to health. That when BMI standards are based on European men, they fail. That when the understanding that Black patients still feel less pain, it fails. And in practice, that means that you can think about auditing clinical tools and guidelines to understand the built-in bias and remove it as a practice of the right to health. Second, let me talk about the commercial determinants of health. That this principle, as she put it down, which was conditions, actions, and omissions that affect the right to health, that those are a right to health concern. And so in her food report, she talked about the ways that corporations are extracting resources from low-income countries by flooding them with ultra-processed food. The idea that this is in and of itself neocolonialism, racism, cultural erasure, and extractive capitalism had not previously been understood to have implications for health and the right to health. Dr. Mofokeng put those front and center. And so that means that conversations about front of package warning labels are not just about good public health, but they are about rights. They are about inalienable rights. They are about fundamental rights. Third, criminalization is a determinant of health. So here, Anand Grover had done some important work, and Dr. Mofokeng picks that up and drives it home. And so she talks in her report on drugs about the idea of decriminalization as a health intervention. That if you think about this like a clinician, you think, what is the intervention that will improve people's health? And that the intervention that is necessary is the removal of criminalization. And so decriminalizing possession, funding a full harm reduction package, making available needle and syringe exchange programs and opioid substitution therapy, that these are in of themselves interventions, but they are also a rights intervention. And that separating health services from law enforcement is not just a good practice, but it is a requirement of the right to health. Two more. One, healthcare workers as human rights defenders. This idea of the practice of medicine as a tool for the promotion of human rights is the central piece, and I won't go into all of the pieces in which she does this, but the idea that fixing the push factors behind health workforce migration is a right to health issue, not just for people receiving health care, but for health workers themselves, and that they are holders of rights as well. And then finally, the idea of digital colonialism. So we are seeing this right now, that data becomes a commodity and data is exported from south to north. And that in fact, we are seeing increasingly states demanding not access just to mineral resources, but also access to data, because that is the fundamental power of our time. And so thinking about that from a right to health perspective, Dr. Mofokeng lays out the idea of data extraction as a violation of the right to health, and that consent and data sovereignty rules are fundamentally part of a human rights infrastructure. So in those four things, what does she do? She makes coloniality and race an organizing lens for the mandate. She brings intersectionality in as an operational tool, not just as something nice to talk about, but as the way in which you get to substantive equity. She brings health workers as defenders, digital colonialism, reparations, and non-binary accounts of gender-based violence to the mandate where they had not been. And fundamentally, she moves the mandate's center of gravity from content and judiciability towards power, history, and exclusion. That is a major contribution, and for that we are grateful. Thank you.
Thank you very much, Matthew, for this scholarly analysis. And in 5 minutes, well, 7 really, but Alfonso Barraguez is Deputy Chief of UNFPA's Geneva Representation Office. Alfonso, known to many of us, is a human rights lawyer with 23 years of UN experience across OHCHR, DPKO, and UNFPA, worked in Guatemala, Rwanda, Angola, and Mozambique, focusing on human rights-based approaches to development and sexual and reproductive health and rights. Mr. Barraguez will reflect on implementation contributions at country and regional level. You have the floor.
Thank you, Victor, and a warm hello to Madam Rapporteur, still on the job, and to all distinguished participants and my fellow panelists. And with that introduction and reflecting on, as I prepare my talking points or my notes on the mandate, I was realizing that, I mean, I've been some years on the job because I've been working with all the mandate holders since the creation of the mandate by the old Commission on Human Rights in 2002. No, luckily, Dr. Kavanagh has given us already a picture of that evolution, so I don't need to delve into that. But definitely for an agency like UNFPA, all the mandate holders on the right to the highest attainable standard section physical and mental health are certainly important entry points to leverage our mandate. Since Paul Hunt, not only the AAAQ, but also a very critical moment when, with the MDGs, there was an exclusive focus on maternal health issues, and through his support, we managed to position sexual health in that global framework. With Anand Grover, obviously, with his focus on key populations, coming from the HIV movement, the work with him intersected completely with the work of UNFPA, which has the leading role still today under the UNED's global program on key populations, and with Daniel Spouras, who put an emphasis on adolescent sexual and reproductive health and adolescent autonomy. Tlaleng has been the first woman and African holding the mandate of a special rapporteur and a medical doctor herself, coming from the field of sexual and reproductive health and rights. And she has shifted the mandate towards an intersectional human rights-based approach that centers on dignity and addressing deeply rooted structural drivers of health substantive inequality. Dr. Kavan, as I say, spoke a lot about that, so I will not insist. I fully subscribe what he has presented. Therefore, with those parameters or that premise, it is clear to understand how Dr. Tlaleng's mandate has served as a strategic point of alignment for UNFPA. Her collaboration with us, or our collaboration with the mandate, has started here in Geneva, supporting her mandate through the submission of information from our regional country offices to her thematic reports, but also through the support of our country offices in the course of her country visits. We have had also the pleasure to be together in events at high level, at the General Assembly, at the World Health Assembly, that had helped to amplify the messaging of her reports beyond these rooms, beyond the Human Rights Council. We have provided consistent, I think in all the sessions of the Human Rights Council, UNFPA has issued statements welcoming her reports and reinforcing the importance of her focus areas such as the right to health and care workers, intersectionality, and the right to health in the context of technological change. But finally, more importantly, on the issue of mainstreaming, we have definitely taken on board the vision and recommendations of the Special Rapporteur in shaping our strategic plan and country programs. The more important would be how we have taken that guidance on board for the formulation of our LNOB, Leaving No One Behind, strategy as a core pillar of our strategic plan, designed to prioritize the most marginalized populations in accessing sexual and reproductive health and rights. The strategy emphasizes an intersectional approach to reach those furthest behind, such as women and girls, indigenous populations, refugees, persons with disabilities, LGBTIQ+, and youth. The strategy focuses on making the invisible visible, addressing root causes of structural discrimination, ensuring universal access to inclusive services, and strengthen partnerships through the active and meaningful participation of those groups. There are other areas, of course, that due to the interest of time, I will have to skip, but which are coincidental with previous panelists. Her work on health and care workers, very important also in the work we do in the area of midwifery. And particularly one point I wanted to highlight there is ensuring the well-being and fair work conditions of those workers so that they can also perform as human rights defenders. Midwives not only are workers that provide community services, they are also agents for change in their communities. And as a result of her vision and recommendations, we have included the promotion of transformative leadership in the midwifery training programs. And I had some final thoughts in terms of the way forward, which I thought may be interesting for discussion later on. I think that at the conclusion of her mandate, it is important to build on the work of the Special Rapporteur to continue to undertake research and human rights evidence in the evolving field of technology and health, with a focus on artificial intelligence and how artificial intelligence is going to impact on the health workforce in the future, and all the ethical human rights consideration around scientific progress. Second, the right to health in the context of demographic changes through the lens of a life course approach. For instance, how right to health will intersect with population aging and sustainability of universal health coverage and social security systems in the future. Thirdly, in the post-2030 reproductive health agenda, we are already working on an interdisciplinary process for reproductive health agency measurement, focusing not only on reproductive agency as the ability of women to say no, but also the power to say yes and enjoy their sexuality. And finally, a process consideration where I coincide also with Marcella in terms of what you already initiated, which is also important to say, taking the health conversation outside of the silo of the Human Rights Council and broaden an interdisciplinary engagement, including health, human rights planning, and finance actors. So that would be very important in terms of sustainability of health systems and social protection systems. So let me conclude by extending my gratitude to Dr. Tlaleng for her unwavering commitment and significant contributions to advancing the right to health and dignity for all everywhere without discrimination. Thank you.
Thank you very much, Alfonso. And as you were laying out these ideas for further action, the same as Marcella did and our other distinguished speakers, part of the idea of these harvest exercises are precisely to take stock of where is it that a mandate is left, the doctrine under that mandate is left, and what are the avenues that need to be explored in the future. So we thank you for that. Gabriel Galil is our next speaker and last in the panel. He's Senior International Advocacy Advisor at the International Planned Parenthood Federation, UN Liaison Office in Geneva, where they represent IPPF across Geneva-based processes on human rights, health, and humanitarian issues. Originally from Brazil, Gabriel previously served as UN Program Manager at ILGA World for 6 years before joining IPPF in July 2025. Gabriel will close our round of contribution with a stock-taking and forward-looking reflection. So very timely. Gabriel, you have the floor.
Thank you, Victor. Your Excellencies, Special Rapporteur. I'm very honored to be the civil society speaker on this panel, and I'm very honored because Dr. Tlaleng saved no efforts to engage with civil society and affected communities throughout her mandate. So I know it's a special place to be holding here, and I hope to make justice to it. So I'd like to start by just presenting IPPF. We are a federation of delivering sexual and reproductive health in more than 150 countries through our locally owned and globally connected member associations. And we try to reach those more left behind, including women and girls in humanitarian settings and criminalized and marginalized communities. So for us, collaborating with Dr. Tlaleng came naturally. The values that underpin her tenure, such as health as dignity, anti-colonialism, and anti-imperialism, are values that are actually enshrined in IPPF's chart of values. So we are very happy to share those values with you. And we did that in a time where global health is intensely politicized, when structural determinants of health are deteriorating, and when many member states refuse to see the linkages between realizing the right to health, including SRHR, and expanding access to medicines, transferring technologies, relieving international debt. In this context, Dr. T was a coherent voice, one that engaged member states from every region of this council. Her tenure took place in a period of immense growth of anti-rights mobilization at the local, regional, and global levels. Abortion rights defenders and providers were targeted, smeared, and threatened. SRHR was branded as too controversial by many member states, and some mandate holders sought to roll back rights of trans people and sex workers, directly undermining the rights of bodily autonomy. Through all of this, Dr. Tlaleng stood firm. She gave us She gave those of us working on the right to health, including sexual and reproductive health, rights, and justice, a body of brilliant, carefully argued reports showing how clear international human rights law actually is on the protection of SRHR. She called for decriminalization of abortion and stated plainly that decriminalization is necessary for the right to health to be realized. She challenged the criminalization of sex work and traced its contract's harms to health. She advanced a holistic, non-binary understanding of violence, including violence based on sexual orientation, gender identity, and sex characteristics. And she grounded all of this in an anti-racist and anti-colonial analysis, exposing how racism and colonial legacies continue to shape health laws, systems, and outcomes. Her work consistently centered the people most often pushed out of care, people who use drugs, sex workers, LGBTIQ persons, and people living with HIV. She also recognized health and care workers as human rights defenders deserving protection. For us, this is not just an abstract normative development. It speaks to the lived reality of our member associations and our colleagues. She honored the reality of our colleagues who have experienced human rights violations directly, like the staff of the Sudanese Family Planning Association who were kidnapped in Al-Fashir last year. For our colleagues on the Palestinian Family Planning and Protection Association in Gaza who kept working at the risk of their own lives after our only clinic was bombed in 8 October 2023. Among them, Dr. Tabat Salim, team member of PFPPA, who was killed by the Israeli army in January 2025, only hours after providing health services to those most in need. We thank the Special Rapporteur for confronting the genocidal acts perpetrated against Palestinians in Gaza and for holding the line in the fact of coordinated attacks on her. Dr. T leads a solid and remarkable body of work, one we hope will keep informing this mandate for the years to come, and to champion the collaboration of civil society and affected communities at a time of unprecedented shrinking of civic space. That too is part of her legacy. This legacy will help us to navigate this incredibly difficult moment of a global health funding crisis and reform, of attacks on human rights multilateralism and on human rights defenders, including healthcare workers. As IPPF, we will save no efforts to keep this legacy of work alive through our continuing implementation of the standards that Dr. T developed and highlighted through our federation's work, and by our continuous engagement on advancing SRHRJ in the global spaces. Thank you.
Thank you very much, Gabriele. No doubt this will be part of the stock taking that scholars will be able to carry out in the months to come, so as to understand exactly how you, Tlaleng, have made advance the doctrine under this resolution. With Gabriel's intervention, I also have the cue to thank two of our co-sponsors of this event coming from civil society. One of them is the Center for Global Health Policy and Politics, and the other one is IPPF, who have facilitated some of the activities of the Harvest Committee that I am honored to chair for Tlaleng. We now have a space in case that the floor would like to offer comments, questions, or engage in dialogue. And I understand that I'm to offer the floor to the distinguished delegation of Switzerland. You have the floor.
Mr. Moderator, distinguished panelists, dear colleagues, I'm a special rapporteur. It is a real pleasure for me to thank you in the name of Switzerland for your engagement and your excellent work during these last 6 years. Building on your expertise and the knowledge accumulated through your years and hard work on the field, you have produced a corpus of reports that have helped shaping the international debate on public health. In this regard, I wanted to highlight especially your two reports on drug use, harm reduction, and the right to health, and harm reduction for sustainable peace and development. In these reports, you have underlined the importance of harm reduction as a central tool to realize the right to health. You have also highlighted the need for states to move from a reliance on criminal law to take instead a human rights-based, evidence-based, and compassionate approach to harm reduction in relation to drug use and drug use disorder. Your work demonstrates the importance of involving marginalized groups and people who face discrimination in the development and implementation of the policies that affect them. Madam Mofokeng, we have followed your work and read your report with great attention. Switzerland truly believes that it has and will continue to help us in creating better policies to realize the right to health for all our population, including the most vulnerable. Thank you for all this.
Thank you very much. I'm scanning the room to see any further requests for the floor. If that is not the case, then we now have the great pleasure. Oh, yes, please. Distinguished representative of State of Palestine, you have the floor.
Thank you, Mr. Moderator. And thank you, distinguished panelists, for your interventions. Sorry. Okay. The State of Palestine is pleased to join others in recognizing the important contribution of Dr. Mofokeng during her tenure as Special Rapporteur on the right to health. Throughout her mandate, Dr. Mofokeng consistently reminded us that the right to health is not merely about access to medical services, but about dignity, equality, justice, and the conditions necessary for people to live healthy lives. Her work has helped strengthen a holistic and human rights-based understanding of health, while giving particular attention to those most often left behind. For Palestinians, her voice has been especially significant. At a time when Gaza has witnessed the near-total destruction of its healthcare system, she has spoken with clarity and principle about the protection of healthcare workers and medical facilities and the fundamental right of all people to access healthcare without discrimination. She has consistently refused to treat health as a technical issue detached from its root causes, affirming that the realization of the right to health cannot be separated from freedom, dignity, accountability, and the right of peoples to self-determination. We thank Dr. Mofokeng for her courage, integrity, and unwavering commitment to placing human dignity at the center of the right to health, and would like to take this opportunity to wish you every success in future endeavors. We thank you very much.
Thank you very much, madam. I'm quickly scanning the room. I see Nathalie Rondeux.
Much. I'm Nathalie Rondeux, and I work for the Office of the High Commissioner for Human Rights. And I'm sorry I was late for this panel, but I wanted to stress something, because we are here, of course, to praise the work that Tlaleng Mofokeng did on her right to health mandate. But there is also another important part that she did for the special procedure system, because she was also part of the coordination committee, and she was the chair of the coordination committee for 1 year. And sometimes people don't realize the work it is to try to coordinate all the special procedures, to make them more visible, to be the interlocutor vis-à-vis member states, NGOs, the council. And this was also something that she did with dedication, patience, and kindness, and she was really recognized by her peers in doing so. So I just wanted also to add that to go to the conversation. Thank you, Tlaleng.
Thank you very much, Ms. Rondeux. I have now the distinguished representative of the delegation of Thailand.
And thanks the organizer and co-sponsor for this event. Thailand had the honor to be one of the last countries visited by Dr. Mofokeng during her mandates. And in this regard, we would like to commend her for her approach that seeks not only to identify challenges, but also to inspire positive changes in our country. And your visit, Dr. Mofokeng, to our country has offered constructive recommendations, highlighted areas for improvement, and brought us with fresh perspective by bridging international human rights standards with realities and good practices on the ground. Many of the values that you have championed throughout your mandate resonate strongly with Thailand's own commitment to advancing right to health. We share your belief in the importance of equitable access to healthcare, universal health coverage, and people-centered health systems, as well as health needs and rights of marginalized and vulnerable groups. And we consider ourselves to be partners in this common endeavors. So, last but not least, we just want to thank you for your dedication and your constructive engagement and inspiring leadership. And we wish you every success in your future endeavors. Thank you.
Thank you very much, Madam Representative. And we now have, I have the sad honor of giving you, Tlaleng, the floor for the very last time in this August hall as mandate holder. So you have the floor.
Thank you so much, colleagues. I don't even know where to start, really. But firstly, to say thank you to the missions of Brazil, South Africa, and Switzerland for your kindness in co-sponsoring this parallel event. And of course, to GHPP and IPPF as well. And our lovely moderator here, who's seasoned as our former independent expert on Songi, Victor, and the rest of the Harvest Committee, and to this amazing panel. I wouldn't have done a better job even if I did this myself. So thank you so much for honoring the invitation and for saying yes. For me, as I sit here, I'm thinking, are they talking about me? So I have a lot of work to do to internalize what the last 6 years has meant. And I think what has been produced. I think when you are in the moment of the doing, you don't often take time, and there was no time in this mandate to stop, to take stock of it all. And I think it will all come crashing at some point. But today has been a really incredible start to what that reflective process for me will be as well, of what perhaps could have been done, could have still been achieved. But just to say my deep, deep gratitude to all of the member states who also made it to the room today, and your different contributions and your collaborations and your cooperation. This mandate on the right to health is one that for me, and I say this without bias, that it's one of the most interconnected human rights that really shows where the life of the economic, social, cultural, and political rights live. And so I've taken this role with that deep sense of duty and responsibility. And I've always said that, you know, when I leave this mandate, I hope that more and more people see themselves, hear themselves. When they read the reports, they can identify at some level with some of that content. And so with the word limitations of the UN, there's a lot in those bold texts, but there's a lot that also lives in those footnotes. And it was important to elevate and amplify the voices, make visible those lived experiences that are often continuously made invisible by structures of power and authority. And so I've been incredibly grateful that I was the mandate holder during a pandemic, during some of the world's worst crises that we have a collective memory of. And I think COVID-19 also in its disappointment in how global health responded, you know, to vaccines, but also incredible lessons around solidarity and what that can look like. And throughout my reports, I've really tried to intentionally seek out people's stories, people's ideas of what they vision for the world, and interpret that and turn that into something that is tangible from a human rights perspective. And the country visits have been really important and quite significant. So thank you very much, Tlaleng, for that incredible intervention, because for me, they were a moment to connect with the rights holders from where they are in their everyday lives. And it was so important to go to where people live and not just, you know, host meetings in a hotel room. It was to leave and go to where the hospitals are, take the difficult boat. Karen knows how difficult some of our journeys how they were. You know, sometimes we're considering scooters, you know, just to get to where we needed to get. And indigenous peoples, you know, teaching me amazing concepts such as cosmovision, you know, that the health of the planet and of the world is intertwined with our own health as humans, and how I take some of those important lessons forward too. So I've learned and grown as a mandate holder. And, you know, I tell some of my close friends the story, but growing up in apartheid South Africa, the last memory I have of being a child was at 5 years old, because from 6, I was already in protest action. And so I feel like this mandate for me has helped take me through a process of what it feels like to be fought for. And so in a way, I was fighting for that 6-year-old Tlaleng who had a right to a childhood, who had a right to physical and mental health that was not compounded by racial segregation and apartheid. And I knew what I would have envisioned for myself and my peers who didn't make it, because for me, it was still really a series of perfectly aligned miracles that I could even dare to think I could even be a special rapporteur. And that I know for the next generations and the ones that we continue to lose every day, they can't depend on a series of perfectly aligned miracles. So we have our work cut out for us. And so it's my hope that through my contribution to this mandate, that people such as my own peers who who didn't make it, some who are still at the margin, who are still trying to make it, that the human rights system seeks them out. We need to seek people out. We need to be intentional about the places where we go, but also maybe where we don't go. Those are important decisions, all of them. And in closing, because I know you asked me very nicely yesterday, do the proper 10 minutes, not the Dr. T 10 minutes. So I'm going to be very fair to you as a colleague and a friend, and just say that in closing, I want to bring us back to this idea of dignity, but what it means for global solidarity, which I think is really needed in the world right now. And speaking to diplomats, again, I don't know when I'll ever be allowed in this august house. So let me take this opportunity to say one more time that I think that when governments are meeting their obligations under the right to health, it is really important to always question power and power asymmetries, because whether it's corporations, non-state actors, even the state itself, there are ways in which the laws, practices, and norms and policies impact on health and care workers' abilities to translate policies and these important documents that you negotiate every day into tangible right to health and dignified care. And we ought to have a lot more of them in the rooms, in the regions, in the global health space, where they can tell us what has been the problem so far. If you look at the spending in global health, it's not a lack of more dollars, it's that the dollars that are already being spent are not yielding those outcomes that we all expect. And they are the people who are best placed as experts, who are there, whether there's a genocide or not, they remain. Whether there's a climate crisis or not, they remain. Where there's poverty, they remain. So they really are important as interlocutors. And I want to say, of course, to my health and care workers, and I am one as well, I know the difficulties that we all continue to work under. And just to say that I continue to do this work, hoping that the conditions of our work itself is conducive for us to realize the right to care and really support a life conducive to dignity. And so in closing, I just want to say all of us that we are best placed still and have a huge responsibility as people in this room to not only speak for our own constituencies, but also be intentional about who is heard, who is seen, and who we bring and lift forward as we do this work. And I hope that for the last 6 years, many more people were lifted, were brought forward, were centered through the mandate's work. So thank you again for organizing this. I am deeply grateful and have a lot of work to do to internalize what has been achieved in the last 6 years. So thank you very much. Ke a leboha.
Many of us were yesterday at the Human Rights Council when Tlaleng gave her interactive dialogue. She spoke about bringing the margins to the center. That was a chilling moment. She then said that she's going back to the margins. That's not going to happen. Thank you very much to the sponsoring organizations, to Brazil, to South Africa, to Switzerland, to the members of the panel, and to all of you. Thank you so much. Have a good rest of your week.
Bien.